does it mean that we need to fix your bite? Have you ever heard the term occlusion from your dentist? Well, welcome to the Wonder Tooth podcast. And today we are very honored to have my friend, Dr. Kamel, who is a top prosthodontist on the East Coast. Hi, Dr. Kamel. How are you today?
Hi, Radwa. Hi, everyone. I'm very happy to be with you today. I'm very excited to give you some of my information and my insight about my specialty, which is prosthodontist. Prosthodontist, I'll give you a little bit of my experience and my history. My name is Mohammed Kamel. I'm originally from Egypt, graduated from Cairo University back in 1995. And I have a special training in prosthodontics and master degree from Swiss Canadian University from Egypt. I came here to the United States in 2007, and I have my residency in prosthodontist. Actually, to be a prosthodontist, I have to take 3 years and plus if I want to do a master degree in residency in one of our accredited programs in the United States. This 3 years involving full-time training in one of the universities and dental school in the United States. It happened to be Rutgers University. Back then, it's called UMDNJ. And the 3 years involving full mouth rehabilitation training, implants, crown bridge, name it, every restoration, and we have to place at least 25 implants in the residency. After that, I was working as a faculty and teaching in Rutgers dental school up to 2022, and then I moved to the Clear Choice Dental Implant Centers to be a full-time implant providers, work with patients in need with the full mouth rehabilitation, and give them a new smile, a new life for them.
Yeah, and you are saving lives basically because people can actually chew after you fix when they have no teeth at all. Yeah.
We're changing life. So as a prosthodontist, we are specialized in full mouth rehabilitation, implant restoration, aesthetics, a change, like a makeup change of the aesthetics. And another site that we work for to help the congenital anomalies that patients born with congenital anomalies like palate cleft, after surgery, they need prosthodontic help. Patient with acquired anomaly, like God forbid, cancers, and they remove half of their mouth. So the maxillofacial training that I restore their missing parts, not only teeth, sometimes eyes, sometimes ears. This is another part of the people who don't know who restore this. Okay, so we work side by side with a surgeon, with an ENT doctor, with a cancer institute, with a cancer team to help those patients. And another thing that we specialize in helping TMD problems, with problems in the TMJ, in the joint here, that people that sometimes they develop clicking or pain, so we can help stabilizing the joint by restoration and other means as well.
A prosthodontist is a very specialized discipline of dentistry. So pretty much everybody knows what the oral surgeon is. You pull a tooth, we're good. To pull wisdom teeth, sometimes we fix, broken jaws. A root canal specialist, they do take care of the nerve. So a prosthodontist, as you mentioned, you restore not just the teeth, but you can also restore the face.
Yes.
Tell me about one of the, difficult cases like, that you had to deal with.
So cases like if we have patient coming from out of cancer and remove half of the maxilla and other parts. So we work side by side with the help of the digital dentistry, and we can scan the site before even the surgery. And whatever part we replace, we can kind of 3D construct the teeth. And with the help of the surgeon, he can restore the missing bone as much as we can. And we can place implants in the new, sometimes they take something from their hip or rib to replace or restore the missing part of the mouth, and we can work together and restore the teeth on that piece after surgery. And it takes like a year or 2 years just to complete the treatment with temporary dentures and then the final restoration. And in daily basis, we deal with the bite, and we call it occlusion. So complete mouth rehabilitation. A patient come without teeth, like seeking for either dentures or a full mouth rehab using the implants. So we have to build their teeth in respective to the joint, to the muscles, because it's not only, we're not only dealing with teeth, we're dealing with muscles, nerves, joints, tendons, all this work together in harmony with we call it occlusion. As a slang term, it's a bite, but the bite means occlusion, which means that we study the science that study the contact of the teeth in static contact and dynamic contact. So if any restoration, even one restoration, one crown is wrong, it's not only cause damage to the tooth, it causes damage to the opposing tooth, it causes damage to the muscles and going to the joint, and we're going to have something called TMD, like temporomandibular dysfunction, which the patient doesn't know where the pain comes from, but it might be from a very small restoration recently received from a dentist that the bite is not adjusted and it can cause all this problem. So imagine dealing with not only one tooth, imagine dealing with all the teeth, 28 teeth in the patient mouth that need to be checked. So this is part of our work as a prosthodontist to make sure that the new teeth will be in harmony with the joint and the muscle that already existing in the patient mouth.
Yeah. Yesterday I was placing a crown, and we put that little blue paper, and the patient is like, what is that? Can you tell? And I said, well, because we studied occlusion, and this is exactly what you said. We know exactly how the teeth should be intercuspating together. So we have to adjust, the areas that are not supposed to be touching, so that when the patient is biting like this or sideways or even in protrusive, it should be in a proper alignment.
Yes, because if it's not in proper alignment, it will interrupt with the path. And this can cause stress, overstress on the tooth that we restore because it's high, like banging on the head, and stress on the tooth that opposing to it, and can cause pain on the upper teeth. Not if the restoration in the lower teeth can cause even pain on the upper tooth. And this can translate it to the joint that can control it, because the patient will avoid biting here and acquire another bad habit to avoid the right side,
to the other
go to the left side. So it can cause stretch on this muscle, okay? And then after that can cause pain on the muscle, nerves, everything related to this area. And the patient come in the excruciating pain that it doesn't know what's happened, okay? Any pain, I would say, happened after a couple of days or 3 days from the restoration, that means that you need bite adjustment, occlusion adjustment. Yeah.
You mentioned also like the full mouth rehabilitation. What does that mean? And who is a candidate for this? How can anybody says I need a full mouth rehabilitation? What does that mean?
So dental disease, as we know, for everyone that we have caries, we have periodontitis. Like the caries is a bacteria that can affect targeting the tooth and cause decay on the tooth until you lose a tooth or have a pain on the teeth and you end up by extracting the teeth. Another cause of extraction of the teeth is periodontitis, which is disease bacteria that targeting the bone around the roots of the teeth. And unfortunately, this is sometimes that we cannot control it. Even the patient can control it, has nothing to do with it. It's more genetically. So we can have the same type of bacteria, but the patient is more prone, because genetically prone to this kind of bacteria, and can cause damage and lose the teeth. If the patient lost 50% or more, and the existing of the teeth, like he's missing teeth, and the existing teeth cannot hold, they are not has not good prognosis, that we cannot rely on them. In this case, we need a full mouth rehabilitation. So we can replace the missing teeth with implants. we can crown the existing teeth with the crowns or remove totally the existing teeth because they don't have a good prognosis. So it end up by edentulous mouth, like no teeth in the mouth. So with the help of the implants, upper and lower, and definitely restoring the teeth, and with the help of the occlusion, can restore back the full mouth, when we call it full mouth rehabilitation. So it involves mix between crowns or an implants, or can be solely on implants. Or if the patient cannot afford the dental treatment with the crowns or the implants and end up by extracting all the teeth, so now he is the only help to make a denture, complete denture. That complete denture means it's just replacing all the missing teeth, and now he will be having dentures upper and lower. Again, that's the minimum can help to help the patient to chew and to survive.
You know, my last episode was about why anybody should have any missing tooth replaced as soon as possible. Could you tell us more why this is very important?
Yeah, because once the brain maintain everything, control everything. So if we have a full set of teeth, there's no problem. If one tooth gonna be extracted, so now you have many things happening. The teeth hold in place by contact. So if the tooth removed, the neighbor teeth, right and left, will tend to close this space. It's just habit, okay, happening. So they talk to each other and say, let's close this space. We don't like the space. So the neighbor teeth will move and then leave a space between them and the other neighbor teeth that create spaces. And the opposing tooth from the top will move down to try to close the space. So now create a chaos that shouldn't happen. So the teeth are not in the same place. They cannot even close the space. So even this like effort is wrong. And the same thing that at the same time, the bone that was holding the tooth that gets extracted get resorbed, mean disappear. Because the brain read that this bone there is no need for that. And the healing process will end up by having no bone. So the more time you wait, the more loss of bone, and it's very difficult to restore this with an implant. So imagine this happened with 2, 3, 4 teeth. It end up by having even no bone. Sometimes the patient has no bone even for the implant help. So it's very, very important to react immediately to restore the tooth immediately with dental implant before it's too late, and you'll end up by even extracting the neighbor teeth or doing like having braces to correct this, adding to the cost of the treatment. And then if you don't have bone, I have to make a bridge because I don't have to bone to place the implants, and now I am like preparing another tooth that innocent, that really is like virgin teeth that even doesn't have any decay, and now I'm creating another problem because I didn't react fast and enough to deal with the space.
And this is also very important why it's when we are pulling teeth, we have to have a treatment plan ahead of time. Not let me pull it and then you go figure it out. If we're pulling a tooth and we're planning to put an implant, we have to put a bone graft in that area. Otherwise, the whole area is going to collapse.
Exactly.
How soon should they, or no, how long should they wait before they can get an implant? Like how long? Like 5 years, 10 years, or the bone is going to resorb in that area?
The resorption of bone depends from patient to patient, the type of bone. But I would say they should react within the first year, be safe. So that's why you said the treatment plan. So before we extract the tooth, we have to tell the patient our treatment plan to place the implant. If the patient agree with the terms, we can place the implant the day of the extraction. And this would be, and sometime if it's in the front tooth, we can place not only the implant, we can place the temporary crown.
Temporary.
So imagine that the one tooth here in the front that has to come out, and how are you going to go to work? How are you going to communicate with your people in the work? So this is a very, very important tool for the implant, and definitely we couldn't do it before the implant era.
But it depends on the type of the bone and
Yes.
the angulation, and if it was an
other
easy
stuff.
extraction.
It's the extreme, it's the best case scenario, but at least if we extract, put bone graft, and we come after a couple of months to place the implant, this is the minimum we can do to the patient, so we can keep everything as is. And remember, if you extract the tooth and the bone even get resolved, you're gonna have deformation. So the bone here will be high, the bone in the extraction site will be low. So it needs more other than not implant. We have bone graft, we have to build the site again. But if you react immediately after extraction the tooth and we place the bone graft or the implant itself, this would be the best case scenario.
Yeah. It's so funny when I pull a tooth and I look and I'm like, I actually start to talk. Oh, the bone looks so good. And the patient like start to look at me and I'm like, I'm just appreciating what I am seeing here right now.
Yeah.
And they're like, I laugh and then they laugh. Imagine we're bleeding and everything. But
Yeah.
that's a reality. I'm like, really, this is a beautiful piece of bone. And they're looking at me and I'm like, yeah, this is a perfect spot to put an implant right now. I mean, we already have a 3D X-ray and everything, but I'm like, I appreciate little things.
Yeah, you see,
it's all about the little things. Yeah.
It's very important for that to say the treatment plan, and treatment planning is one. When I came to this United States here, this is at the end of my residency, you have to make prepare a presentation for all your cases. So it's like showing off. And after I finished my presentation, there was a question from one of the faculty that watching my presentation said, okay, I know, Mohammed, that you came from Egypt here to the United States and 3 years, and now we see full mouth cases. But what is the most, if you tell me one thing that you like you appreciated the most from all this residency. So I didn't tell him full mouth rehab, I didn't tell him anything. I said, one thing that I appreciate is treatment planning.
Yeah.
The art of treatment planning is how to plan before you go ahead and extract the tooth. Go ahead and touch even the tooth with this motor and the burr, because the patient has to know everything. I have to know everything. What is the next step? So it will make the treatment sequence. It's just very important and smooth, and the patient know what is the next appointment. What is the next appointment? So everything has to be put together in something called treatment plan and treatment sequence.
Absolutely. And sometimes we do, I mean, most of the time, interdisciplinary too. So for example, if that tooth needs a root canal, but it already has a root canal, I always like, okay, let's go for a consultation first before we touch the tooth. Or if something else is going on, there is a cyst or something, let's go to see the oral surgeon first to check that before we touch anything, and vice versa. And I completely agree with you. Really, number one is diagnosis and treatment planning before we even do anything.
Exactly. And when you bring something very important, what is the best time to refer? Not after the fact. No, refer before. So the patient know exactly what are the options, and you can have an option of from the specialist that the surgeon tells you we can extract the tooth and we do this 1, 2, 3, 4. So the patient knows when we decide together, we'll go back to you and have all the means and have all the expert opinions. You can have the right opinion.
Absolutely.
Right.
Absolutely. Well, that was very, very nice, Dr. Kamel, and I'm really looking forward. So this is part one, guys. Stay tuned because we're going to talk a lot about dentures and 3D printing and how this is incorporated in dentures and digital dentistry in general, and all on 4. So stay tuned. That was very nice, Dr. Kamel. I really, really appreciate your time today.
Thank you. I'm very happy to be with you today. Thank you.
And I'm going to put in the show notes how to contact Dr. Kamel. If you guys, you heard how he does, like he's the wizard of dentistry really on the East Coast. So stay tuned. I'll see you next time. And don't forget, if you don't take care of your teeth, they will not take care of you. Keep smiling with Dr. Saad.